Hi all, I'm Dr. Arsha. I'm doing my PhD with Sir. This is my first non-academic kind of talk, so I really appreciate that understanding. So I want to begin where Sir finished. What is suffering? I wanted to know what comes to your mind when you hear the term suffering, just in one or two words. Pain, just pain. Sadness. Come on, please, one word. Okay, I got two words. Okay. 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 So one person told me it's pain, another person told me it's emotional distress. You told me distress. So one thing is sure, suffering is not something objective. It's subjective. It varies from person to person. It's a human experience. What is unbearable to me, what is suffering for me, may not be a suffering for you. Okay, in biomedicine, what is disease in biomedicine? What you call disease? A bodily dysfunction, most often. And in biomedicine, if you say if suffering arises from health related condition, we call it as health related suffering. And have anyone heard this term serious health related suffering? Yes, please. You don't have to say the definition, you can just tell me what is serious health related suffering. That is right, but I will add into that. So, a suffering related to health is called health related suffering, and when the suffering affect a person's physical, social, or emotional functioning and requires a medical intervention or a physician interference to alleviate this suffering, we call it as serious health related suffering. This term was first introduced in the Lancet Study Commission report in 2018. You can refer for the exact definition in that. And there are about 20 plus disease condition and 15 symptoms they listed in serious health related sufferings. Now I wanted to ask, does all bodily dysfunction leads to suffering? Yes or no? Okay, subjective. Can you tell me one example? Yes. Yes, not all bodily function leads to suffering. In a way, ma'am said is correct. I will give you another example. I have color blindness. It's a bodily dysfunction. Does it lead to suffering? Does it affect my productivity in any way? Not necessarily that affect my social productivity or the way I want to live my life. Exactly. So not all bodily dysfunction leads to suffering. We often say suffering and pain, we use that term interchangeably. Is suffering and pain same thing? Yes, pain can lead to suffering. Does all pain leads to suffering? May not be. It's subjective, I agree. Could you please give me one example? Okay. You are still in that biomedicine thing. Yes. Suffering for you. So based on your values, your beliefs, suffering changes. Does childbirth is a suffering? A woman in labor go undergo pain, but in most cultures we don't see that as a source of suffering, right? I'm doing a cosmetic surgery. I didn't like the way my nose looking, and I endured pain, but it's not seen as a source of suffering in that way. Now, not all not all pain can be a source of suffering, and not all bodily functions lead to suffering. Now I will tell a story. So this is as part of my formative research. I met this 65-year-old woman. She is a cancer survivor. So in her family we have like 6 members, 3 grandchildren. The eldest granddaughter is 17 years old, and that time she was doing her +2 board exams when I was talking with her. So this woman, she was the breadwinner before the condition. Now she is not working, and her husband, who is diagnosed with COPD 2-3 years back, and is often end up in casualty with breathlessness. And now her daughter, who is a single parent, is the breadwinner of the family, and she is working as house help. So that's her family background. So when she was diagnosed with cancer, this is the term she hearing for the first time in her life. Then the doctor explained to her the treatment plan. There is radiation was there, followed by surgery. What she understood that once she did the surgery, she can go back to her normal life. So she did the surgery. The surgery was successful. She was cancer free, and she was sent to home. The reality strike her. She was sent home with a colostomy bag. So she was a daily wage laborer. Working with this physically tiring activity was an out of option for her now. She no longer is a breadwinner for her family. She cannot work. She cannot woke up 4 o'clock in the morning and take care of the grandchildren, prepare their lunch. That she cannot no longer do. She often used to visit her temple, which is the place that gave her a sense of peace. Every other week she went to this temple. But now, because of the bag, she fears that what if the bag spilled and stained her clothes, and somebody saw that in a temple premises, seeing that is seen as an impurity. So she stopped going there. She started isolating herself. I think you all are familiar with Kudumbashree meetings, okay? She was an active member of this Kudumbashree meeting. In her community, how this Kudumbashree meeting happening is that they will meet at each member's home, and at the end of each meeting, they will serve this tea and snacks. So in our culture, if you if you visit one home and they provide us with tea and snack, it is impolite to refuse that, right? But she cannot do that, because if she eat or take something, the bag will immediately get filled and she need to clean it. She cannot do that in someone else's house. So she stopped going to this Kudumbashree. She started isolating herself and she became homebound. And this daughter is staying back at her employer's house because of the financial debt associated with her treatment. So this woman now needs colostomy bags. She needs at least 4 colostomy bags per month. So the palliative, she's registered in palliative care, and the palliative care is providing her with 1 bag. The extra bag she need to buy, and she told me it costed her around 950 rupees. So what she's doing is that her daughter is sending some mere amount to home, so they are barely managing with that expenses. So she tried to extend or prolong this bag. After like 8 or 9 days, those who use colostomy bag, itching starts. So if she tried to extend beyond like 12 or 13 days, the itching became so intense. Quote unquote, I started pulling my hair and started running around my house like a mad person till I got physically exhausted. This is the experience she shared after she tried to prolong the use of bag after 15 days. Sarojini, I call her Sarojini Amma. She's alive. She's cancer free. The surgery was successful. Does she living a life she value? No opinion. So suffering is something beyond body, right? It goes beyond body. She lost her sense of self. She lost her identity. She lost her roles. She lost her routine. So Eric Kassel, he argued that suffering is beyond body. Suffering is a threat to your integrity, threat to your wholeness, threat to yourself. When you lose your routine, She is no longer a person visiting temple or no longer a active member of her Kudumbasri. She lost her routine. She lost her responsibility to her grandchildren. She cannot do that. She lost her personhood. So that we call suffering. Does, uh, does society have a response to these suffering? So society do have a moral response to the suffering. Imagine many of you are doctors. So imagine a neurosurgeon who is very well known for his patient care and treatment and stuff like that. He was diagnosed with a terminal condition, and but he started skipping his treatment and started taking care of his patients. He was very compassionate with his patient. What do you call him heroic? Do you celebrate that he's such a great person doing this? Or you will say no, you blame him. His choice, I do agree, but how as a society you see that? I agree. I really agree that you don't judge, but I will judge him. I will say he's a very heroic person. Wow, that doctor is still continuing this treatment. Definitely, I will say that. Okay. I didn't ask you to judge him. I just asked you how you see as a society him. Definitely. Okay. What if a poor woman, who is diagnosed with diabetes like 10, 15 years, and that person is uncontrolled. She never listens. She never complains to her drugs, medications, and she didn't look her diet plan properly and ended up with amputation of her leg. What, as a society, what moral status we give to him? We blame her, right? I blame her. That depending upon the value that change. That's what I'm trying to say. So the society as a whole, that's an individual perspective. As a society, sorry sir. Yes, I do agree. He's making an inform. Okay. So as a society, how we react to that situation? Okay. What the moral status you give to that person? Yeah. I agree, but we often advise her, blame her, victimize her. Okay.
Being heroic.
So I draw back you the attention to the society. Okay. So there is this Chama's way of seeing suffering. In I think that paper will be circulated. In there, to a suffering, there is certain way society respond to suffering. We as a society give certain moral status depending upon the class, depending upon the social status of the person. We judge or we give this moral status to suffering. If a condition is acute and it's an emergency, we often react, oh my god, what happened? Some accident happened. What is our first response? Oh my god, what happened? What if for the past 1 year you are hearing same condition like pain in my leg, I'm not well, from a colleague? Constantly you are hearing that. Will you get tired of that? You are coming every day to your OP and your colleague is every day complaining about one or other thing. Like, I have like 1 or 2 days you will help. Will you help in the 5th or 6th day? No. I'm not talking this as a person, this as a society. When suffering became chronic, people lose their moral status, or the way sufferers narrate their stories, the society's perception changes. So this is how Kathy Charmas sees suffering. There is a certain way society see disabled people, elderly, those with chronic conditions, and that the way how society push them into extreme suffering, isolate them. I will tell another example. There is this stroke survivor who is bedridden, and he is now diagnosed with dementia. He doesn't remember his family or friends or even his wife. He lost, there is urine inconsistency issue associated with that. He often urinate like up to 12 times a day. So his wife, again an elderly woman and with diabetic, varicose vein, body pain, all these issues she have, and she every day she need to change his bed sheet, cleans him, wash this process repeat like up to 12 times a day. So her daughter is staying away with her husband and with her own family, and this daughter often blames her for not changing the card from APL to BPL, where this woman is not finding time to even cook food for herself because of this tireless caregiving activity. And they are financially supported by the nephew. His nephew, so he often he comes sit with his uncle, and on time when he came, he saw that the palliative care nurse has put catheter to this patient so that it is some relief to this woman. So but the nephew became so furious because he was afraid that what if some infection happens, in long run they may cause infection. So the nephew brought another nurse and removed this catheter. Now, whose suffering do he saw? Does the woman is suffering? Does she suffering? Her suffering is visible? No, right? She is living in the shadow. Her suffering is in shadows of patient suffering. We as a society see the patient's illness, so the patient is suffering. Often suffering is invisible of these caregivers' suffering. They are invisible. When society validates only, the suffering became a suffering. You want to say something? Yes. Yes. Anjali, she was talking about that, like how we restrict the patients because of the maybe here in the example you said the caregiver may not have the time to look after the patient, so she want an immediate catheter for that patient. So we all like Anjali Chechi said, we restrict the patient based on if the patient falls, we need to look after that person again, so we will restrict them. That is there. This is also there. That is what I was trying to say. I am not talking about right or wrong. I was just saying that suffering.
The point here. The point here is trying to theorize what is suffering, and what Arsha is trying to do is, yes, the first example on where there is an illness or there is a troubling symptom, or we are in a circumstance where we are restricted. There is a diminishing of self, as Eric Castle said. Eric Castle has a paper on suffering, so where he breaks it down into restrictions of self as a form of suffering. But Charmas adds another layer, saying that how society sees suffering can actually worsen it. So if we are having a disease for a long period of time, at the acute stage we get some sympathy, but over time, kind of it's like ആ പേഷ്യൻ്റ് വരുമ്പോഴേ വേദനകളെല്ലാം കൊണ്ട് വന്നു. നമ്മൾ പഴയ ആദ്യം തൊട്ടുള്ള OP ടിക്കറ്റ് നോക്കുമ്പോൾ വി നോ റിപ്പീറ്റോളം നമ്മൾ അടിക്കും, ശരി കേട്ട്. അപ്പോൾ പക്ഷേ അവിടെ ചിലപ്പോൾ സഫറിങ് കാണും. ഓക്കെ, ആ ക്രോണിക് ലോങ് ടേം നമ്മുടെ ഇന്നത്തെ ഇന്ത്യയിൽ, കേരളത്തിൽ പ്രത്യേകിച്ച് ഏജിങ്ങും NCDസും ഒരുപാട് കൂടി വരുമ്പോൾ അവിടെ വരുന്ന സഫറിങ്, നമ്മൾ ഒരു ബുക്ക് ഓഫ് കൺസൾട്ടേഷൻസ് ആൻഡ് മെഡിക്കേഷൻ ലിസ്റ്റ് വരുന്ന ഒരാളും കൊണ്ട് വരുമ്പോൾ ഒന്നും നമുക്ക് ചെയ്യാനില്ല, നമുക്ക് കുറച്ച് മെഡിസിൻസ് കൊടുക്കുക, ആൻറ്റി ഹൈപ്പർടെൻസീവ് ഉണ്ട്, മറ്റേന്ന് കുറച്ച് പെയിൻ റിലീഫിനുള്ള എഴുതി കൊടുത്ത് തിരിച്ചു വിടുക. പക്ഷെ അവിടെ ചിലപ്പോൾ ഒരു ഈ സഫറിങ് കൂടി എസ്കലേറ്റ് ചെയ്ത് വരുന്നുണ്ടാവും. ഈ ക്രോണിക് നോൺ കമ്മ്യൂണിക്കബിൾ ഡിസീസ് സഫറിങ്, ദർ ഇസ് സംതിങ് മോർ ബിക്കോസ് ഓഫ് ദ ക്രോണിസിറ്റി ആൻഡ് ദ വേ സൊസൈറ്റി ഡസ് നോട്ട് സീ ഇറ്റ് ഇൻ ദ സെയിം വേ ആസ് ആൻ അക്യൂട്ട് ഫോം ഓഫ് സഫറിങ്. ഒട്ടും പ്രതീക്ഷിക്കാതെ ഒരാളുടെ പെട്ടെന്ന് ഒരു ലൗഡ് വൺ മരിച്ചു എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ എല്ലാവരും പോയി ഭയങ്കര സിമ്പത്തറ്റിക് ആയിരിക്കും. 10 കൊല്ലമായിട്ട് സ്ട്രോക്കായിട്ട് കിടക്കുകയാണ്, അവിടെ ആ പേഷ്യൻറ്റിൻ്റെ കെയർ ഗിവറിൻ്റെ ട്രാൻസ്ക്രിപ്റ്റ് എടുത്തു കഴിഞ്ഞാൽ അവർ പറയുകയാണ്, എനിക്ക് വിഷം കൊടുത്ത് ഭർത്താവിനെയും മോനെയും ഞാനും മരിച്ചാലോ എന്ന് വിചാരിക്കും, ഇനി ദൈവം ആർക്കും സ്ട്രോക്ക് കൊടുക്കരുത്. അവർ സഫറിങ് ആണോ? പക്ഷെ ആ സഫറിങ് കാണപ്പെടുന്നുണ്ടോ? പാലിയേറ്റീവ് കെയർ ടീം പോയാൽ ആരെയാണ് നോക്കുന്നത്? പേഷ്യൻറ്റിനെയാണ് നോക്കുന്നത്. കെയർ ഗിവറിനെ എന്ത് ചെയ്യും? നമ്മൾ എഡ്യൂക്കേറ്റ് ചെയ്യും. ഓക്കെ, so she's trying to bring out these nuances of suffering.
So adding to the confusion, I said suffering is beyond body. Suffering is, according to this medical anthropologist Paul Farmer, he said that suffering could also brought by the larger structural inequality. In the first example I said, she belonged to a poor socioeconomic class. That could be also a source of suffering for her. She has to travel 100 kilometers to medical college to continue with her treatment. So she stopped going for her post-radiation therapy because of the accessibility issue, because of the poverty. She's one step away from poverty. So these larger structural factors also leads to suffering. And I also want to introduce few frictional readings which is not that distinct or different from the real life stories. Have anyone read Metamorphosis? You have read. So you know the plot. Could you just give me 1 or 2 sentence? What is the plot?
Metamorphosis by Franz Kafka. So a salesman actually wakes up one day and finds that he has become an insect. So his human attributes, he has suddenly lost all the human attributes and he is in the form of an insect.
Yes.
So this book actually is very relevant today because we have lost many of the human sides that we associate with many of the jobs, and it is very relevant in the context of AI, that is AI revolution.
Thank you for that. So now I will try to relate with suffering. So Gregor Samsa was the main character. As he mentioned, he was a salesman before this metamorphosis. He was very proud because he was looking after his family. His sister adored him, and his parents were really proud of him because he was such a contributing member to his family. On fine day, he woke up into this monster looking like insect. At first, the family thought he will come back to his normal self. They do cared for him. They give his suffering a high moral status. Over time, they understood that he is not going to come back as their brother or son. So what happened is that this family started isolating him, which they neglected him and finally abused him, and which leads to his death subsequently in the story. So over the time, the moral status associated with his suffering also changed. He no longer a contributing member to his family. So that is, it's a way that family started isolating him. The way society isolate a disabled person who no longer contribute to the society.
Actually, there is one scene in which he is pushed into some isolated part of the house.
Yes. He was thrown, his father kicked him into a room. That is exactly the way. When he tried to come out and prove that, hey, I exist here like this, but his father became so furious and he pushed and thrown apple into his body, which got stuck and which became a wound, got infected, and eventually he died. So that is one friction I want to introduce. Next one is Death of Ivan Ilyich. Anyone? It's a Tolstoy's story. So it talk about death, okay? this person was a very materialistic, very successful, accomplished so many achievements in his life, and he diagnosed with a terminal condition, and he is in deathbed with existential suffering, with extreme physical suffering. Then he tried to think what was the meaning of my life. Then he found that his life was so hollow, so meaningless. These extreme suffering leads to a point of spiritual awakening for him. So suffering leads to awakening, thinking about the meaning of life for this person. That's how this death of Evangelist leads to suffering. You can go back and read if you want. The next book I want to introduce is the Viktor Frankl's A Man's Search for Meaning. Does anyone read? Okay. Great.
Only reader in the room.
Yeah.
Actually, this book means a lot to me because this is the story of a Jew actually who went to a concentration camp run by Hitler Nazis, and he shares the experience during that time, and he knows that there is no hope after this. He's going to die, which is a very profound situation, and in spite of this hopelessness, he cling on to that meaning in life. That is
Definitely. Here, suffering leads to meaning for him. So, according to Viktor Frankl, a person is not destroyed by the way suffering takes him. It is because when he lost meaning of his life. If a person has a goal, a purpose, a meaning to endure that suffering, that is leads to a meaningful life. So that is so this doctor, he was a doctor, was taken to concentration camp. He saw people enduring significant suffering, but they only death will come only when they lost their purpose. So he's telling that those we have a choice, even though because of the circumstances we don't control the sufferings happening to us, but we do have a choice to the way we respond to the suffering. If we see suffering as some for a purpose, we are doing that, we can endure that suffering. So I just want to introduce these 3 books about suffering, and I wanted to conclude by saying that how these narratives we saw can be rewritten so that we can have a compassionate actions to overcome the differences. I think you all can think about this. Thank you so much.